doing scheduled cases, emergency cases.
And you're on call tonight. Did I hear you say that
I am on call
earlier?
tonight. So.
Okay, so if we hear the beeper go off, that's the only time I let the docs have it on. Other than that, and then we got Giggle Man over here. I love this over here. Dr. Reyna, the CARES Clinic. So you are the obviously a pediatrician, but also the medical director of the El Paso Children's Hospital CARES Clinic. Maybe we can, and we're going to go into it in depth later, but briefly explain what the CARES Clinic stands for and what you do all day, every day.
Oh, thank you for having us here, Catherine. It's a pleasure to be here. Now, I am a pediatrician and just got recently involved with the CARES Clinic. So now I'm the medical director of the CARES Clinic, which stands for Child Abuse Resource Education Service Clinic here. So it's a great opportunity to provide medical services, emotional support, and evaluations and professional medical evaluations for children suspected of child abuse or even just neglect. And we provide this service to the community, and we just like it to become more available. And people know about our services and benefit from our services here. So.
And it's so important right now because there are so many people that are home. Kids are home all day, every day. Some parents who are not able to work are home all day, every day. So just naturally, husband and wives are getting on each other's nerves. And then there's kids, and there's a lot that we're going to be talking about tonight, especially with what has been going on the last several months, and then still to come for the next several months. So I very much appreciate you being
definitely,
here.
definitely.
And I'm gonna, this is fun for me. You're definitely one of those guys that can smile through their eyes even with a mask on. You hear, I don't know if you can see that, but he's one of those guys. It's like you're practicing smiling and you feel goofy, but you've got it going on. I love that. Tell us, Dr. Spurbeck, there is specialists, again, when we're doing surgery, but when you are asking, so there's emergency surgeries, and maybe let's go with those first. I often feel like summer is when kids are outside and they're doing all kinds of nutty stuff, and I'd imagine, I don't know, correct me if I'm wrong, that accidents just seem to be more prevalent in the summer. Is that something that you find in your practice?
I myself don't cover trauma, but trauma season is from probably the late spring through the summer. People out riding bikes, ATVs, motor vehicle accidents. Yes, it becomes a very busy, the emergency room and the operating rooms become very busy, especially with the orthopedic services.
Exactly. So then let's go to what it is that you do mostly. So if you're looking at surgeries that are with children who have had just problems over the years, what are some of the common cases that you have? And feel free to throw a case study out there here and there.
By far the most common operation that we perform is for appendicitis.
Oh my goodness.
Light years above any other type of operation. We probably do half a dozen of those at least a week. Probably on call, probably at least 2 or 3 appendectomies per call. Goodness.
So I did not realize that. How we can go through, I remember it's the left side bottom. What are some of the symptoms that parents and kids, because actually the parents are probably going to be the one that brings the person in, but what are some of the symptoms a little bit?
So appendicitis can actually be quite a masquerader. There's some of the symptoms overlap with your typical gastroenteritis, other illnesses, but typically, and it depends on what age group you're talking about. Younger kids, children 5 and less, present a lot different than, let's say, a 10 or 15-year-old. But typically it's abdominal pain, kind of a generalized abdominal pain, can be a low-grade fever, typically migrates, moves down to the right side of the abdomen. Child loses their appetite, may have some nausea and vomiting. Like I said, low-grade fever. It hurts to move. A lot of times they'll come in, if you ask the parents, say, yeah, it hurt to walk, or when they were driving into the emergency room, every time they hit a bump, the child complained.
Wow. Okay. And you said if they're 5 and younger, they may complain of different things versus above, or just that they wouldn't know what to complain? Or?
So typically, the younger the child, the harder it is sometimes for them to communicate or relay their symptoms or their feelings. So the incidence of ruptured appendicitis is much higher probably when you get 5, 4, and below.
Wow.
Those are the kids you typically seen that have been sick for a couple or a few days. They've got a fever, they may have diarrhea, abdominal distension. Those, probably more than half of those are probably ruptured appendicitis.
Okay. You hit a very good point. So let's talk about right now in the day of COVID, because we're just trying to be realistic. What number one, if a parent notices that, they should not go to the emergency room, right? If you could explain to the audience how El Paso Children's Hospital is kind of logistically laid out now, differently than it was maybe 4 or 5 months ago, of how people come in, how they go out, just to give some solace to people at home as they do come to the emergency room for something that's not COVID related.
Okay, so I'll answer the second part of your question first. So,
Okay.
Obviously there's a main entrance to the hospital. The rest of the entrances have been closed off. There's screening, verbal screening, temperature checks, masks are required. Only one parent's allowed with the child in the hospital. Those are the initial screening tools they're using. If you come through the emergency room and you're going to be admitted to the hospital, you're COVID tested. Mm-hmm. Every child that's admitted to the hospital is tested.
Okay. And are these tests that because I know there's so many different tests, are these tests?
Usually within 2 hours.
Excellent, that was my question. Look at you reading my mind. Okay, and that's so nice to know again, because people, you know, there's that overwhelming fear, and it's good that people are cautious, but if your child needs care, go get care. Dr. Reyna, as a pediatrician, not a surgeon necessarily, talk to me about some of the most common things that, let's address summer, but just some of the common things that you see kids needing care for.
Yeah, you bet. So the biggest thing right now is all the back to school. Everyone's worried about back to school.
Right.
So usually at this time, we're pretty busy with back to school issues like sports physicals and even just their wellness checks that they need to come in for.
And are they doing that? Is that something, or is that a telemedicine thing now?
Since the pandemic, we've seen, since the start of the pandemic with the stay-at-home orders, we've seen a drop in these care of kids during this time. So we have seen probably about 20-30% rate that we were seeing at a time. Now we're up to about 50-60% that kids are coming in for the well child visits. And these visits are really important to make sure that they are developing properly, that they're getting the vaccines to prevent some of these illnesses that we need to prevent. So definitely we definitely need these kids to come in for these well child visits.
So here's a question to you. How much of your practice has become virtual versus people coming in? I mean, it's very important because with children, again, you got to poke and prod, and I respect that. And then obviously for vaccines, you have to have somebody there physically in person. But how are you doing a lot of telemedicine these days?
We are.
Okay.
We are doing a few. We're doing more sick visits, telemedicine. We do encourage parents to come in for the well visits. Just like you said, we do need to see some of their motor skills, some of the develop. It's hard to see over the phone and do telemedicine. So we do encourage parents to bring their kids in for those visits. And also we can telemedicine vaccines. So definitely they need to come in for those visits that are real important to their kids there. But we are making it safe, like Dr. Spurbeck said, along with the hospitals. A lot of these clinics out in the community are also taking precautions here to make sure your family and your child is safe during these times here.
Right. And that's so important to know too. And again, if you're ever able to have a parent come in, that was a question that was given to me, because on some other hospital visits in the beginning, emergency rooms, you were not allowed to have anybody in with you, and now there's allowed to have at least one person, especially with children. It's so very, very important. Let's talk about not necessarily appendicitis, but once a child has been identified to need some kind of surgery, and please feel free to throw out any other surgeries that are relatively common and need to be taken care of and would not be best to hold off for a month or 2 months or 3 months. So name some of those just off the top of your head.
So we see a broad breadth of different problems in the clinic. Some stuff, simple lumps and bumps, skin issues, stuff that can wait. We usually try to, at least right now, try to get past the COVID thing to do. But, you know, we're talking hernias, range from cancers, obviously, those need to be done immediately. There's a whole range of issues that we try to provide as much information for the parents as we can as far as the safety of coming to the clinic and actually getting to the operating room. In fact, I'd say the hospital the hospital's doing everything they can to mitigate the COVID-19 exposure, not only for ourselves from the patients, but to the patients from ourselves. And I'd actually consider the hospital one of the safer zones to be in. I mean, everybody's either got an N95 or some type of surgical mask on. It's very limited and it's very strict, the rules in the hospital. So.
And I love that you said that, and that's something that came up in the last program too. When you're just out grocery shopping or doing the things that you have to do anyway, really in the hospitals and in care clinics, there are extra precautions. And that's again why we want parents to know that if there is an underlying issue and your child does need the care, it's better to get the care. Again, there's telephones that you can call. I'm going to elpasochildrens.org. You can go to that website and throw your questions in there. And also it will give you a laundry list of things of how our children are being treated right now, what the process would be for coming in, what the safety precautions are, and just up-to-date information on there. So again, that is elpasochildrens.org that you can go to. I also want to let the audience know that we are streaming live on YouTube right now. So if for some reason you have to leave your television, you can go to your laptop or your phone or whatever and get that. And then you'll also be able to see this program once again on www.pbselpaso.org. Sometimes we go so fast and people don't remember exactly what's been said. Dr. Reyna, I'd like to start now with you and delve a little bit more into the CARES Clinic. And maybe how old is the CARES Clinic? Is it relatively new, or is it something that's been around for a couple of years?
It's been around for several years here. So the issue is just trying to get the word out with any new program is getting it out to the community and letting people know that we're available and we're here to see your kids that you think that might be possibly abused or neglected, which is kind of sad to see.
Yeah, oh, absolutely. And this is where, again, it's an informational show. So I'd like to give out phone numbers or websites. I know we did the El Paso Children's Hospital. Is there a specific number for the CARES Clinic? And if not, we can have somebody search it for us and then give it to us in
definitely.
a bit.
So the number you could reach us at is 915-242-8560. And exciting news, we are getting a new office location here in the near future, here in the next month or so. So we're looking forward to moving our services and expanding our services.
That's good.
With the CARES Clinic this month. So we're super excited.
So throw me an example of somebody calling, and let's say that I'm the older brother of, a 6 or 7 or 8-year-old who, mom or dad or boyfriend or girlfriend, whatever, somebody's hurting them. This telephone number, call in, talk to us about the process of who answers. Is it a real human? What did they say? Again, I know every case is different, but just throw us an example.
So someone is available 24 hours a day. Now, in our clinic, we take in appointments only. So if it's an something acute that's happening, we do recommend going to the hospital for any evaluation.
Okay.
But if it's something that's you're concerned about or
I'm just thinking about the older brother not wanting to get in trouble. He needs to let somebody know this is happening, but he doesn't want mom and dad to know that he's...
To find out. No, definitely.
Yeah,
we could play that role, and that's where we provide the education and the services for these type of situations there. Now, if a brother is or sister is concerned about them finding out, we try to keep it discreet, and with any case, we don't have to name them as a source there, but it's always good to provide that information to others and to authorities or to us, so we could go ahead and follow through with what's been told to us. Okay,
and that was my second follow-up question is, I'd imagine as the medical situation, you would have to have authorities there too, and how is that interaction between yourself and the police,
law enforcement? So we do work closely, and we continue to work closely with law enforcement and also CPS personnel also here. So we do have a relationship with them and hope to improve that relationship here in the near future.
Excellent.
So we could try to catch these situations a lot sooner before they have to be treated for possible abuse here. So definitely that's kind of our goal, is try to identify them before all this happens.
So let me throw out, I was trying to silence my phone, it's not going to happen. Let me throw out that telephone number again. Again, the area code is 915, number 242-8560, and that is the number for the CARES Clinic. And again, somebody's at that number 24/7 to answer. And again, you were talking about the acronym Child Abuse Resource Education
Services.
Services,
Clinic.
okay, exactly, Services Clinic. So again, that telephone number, it's such an important number, and pass it out, give it to your friends. If you feel that somebody's in trouble, call the number and they can kind of walk you through that information. So again, 915-242-8560. Dr. Spurbeck, I know this isn't related to surgery, but let's talk about heat stroke, sunstroke. Again, I'm thinking about summer issues, and you're a surgeon, but take off that hat for a minute and just think of people coming into the emergency room and have had a heat stroke, and they're little, or heat exhaustion. How much of that do you see in this day and time?
Actually, we as surgeons don't call us for that, but
Right.
I think especially this time of year,
Right.
with this persistent heat, if kids are out playing, if they're not drinking enough water, not getting in the shade, then the incidence does go up in the summer months like this.
Okay. And then also, and I'm just kind of using this as education, and again, take off the surgeon hat for a moment and just be medical guy. I do want to talk a little bit about drownings, about water safety, because this is a pediatrics program, and that's where so many deaths occur. And either one of you, if you'd like to talk about some things that you tell parents or you tell family members, whoever would like to take it.
I'm probably going to defer to Dr.
Okay.
Reyna because he probably does
Okay.
more of the educational
makes
part.
sense.
in there.
Definitely.
Dr. Reyna, tell people what they should or shouldn't be doing. So important.
So the biggest safety for the summer, especially for pools, is definitely protection. Being with your child around bodies of water. Also, I do recommend parents teaching their kids to swim. So when they come in as young as I have a friend or a colleague that does swimming lessons even as young as 6 months here. Definitely if parents or family members have a pool
Right.
in their backyard that's easily accessible, there, especially with toddlers that could just wander out the back door without anyone even noticing here. It's definitely important for education. A lot of it is just education.
Right.
When they come in for these well visits and ask them, do you have a pool, the safety precautions there. And a lot of it is just kind of reminders for
Right.
parents to say, you have a pool, you just have to be a little bit more cautious with little ones around bodies of water.
Right.
Even small bodies of water, even these.
Even a bucket.
Even a bucket, yes,
Yeah.
yeah, definitely.
Yeah.
Nowadays, with this COVID, everyone's in the house, so they're buying above ground pools. They're buying these portable pools. So even those pools
Right.
can be a danger
Yeah.
if they're just left unattended with
There's
little ones
also-
around.
Yeah, and this is not a summer related thing, but there's just curiosity with toilets as well.
Oh, definitely.
That's very common too. Again, working with the El Paso Community Foundation, we have a supporting organization called the Drowning Prevention Coalition. And just look up that website, www, and just spell it all out, Drowning Prevention Coalition. You can have a lot of information there as well. And in there is a link to where you can get teachers that will teach infants. And you're not teaching them to swim. It's just teaching the infant once they get in the water, just how to get on their back
To float,
so
yeah.
that they can float until somebody can get them. So it's
Definitely.
absolutely remarkable watching some of these. It's scary, and you're thinking, oh, I'm not going to throw my kid in the water. But it matters.
Yeah, it does.
It really
does.
matters. Dr. Spurbeck, so let's put your surgeon hat on again. And let's say that we do now have an emergency, a break, an arm break, or like a really bad leg break that's going to require surgery. And specifically for pediatric surgery, we've got the growth plates and the differences there. And I just remember when I learned about growth plates years ago, a surgery on someone who's 6 years old versus someone who's 17 versus someone who's 25 is very different because of the different areas that the growth plates are. How does that work exactly?
Well, again, I'd have to defer a little bit to my orthopedic colleagues because we don't do the fractures, but it certainly does. If the fracture involves the growth plate, depends on the age of the child, how those are approached from a surgical standpoint. Again, I don't fix those, so I don't want to step in
Okay.
their arena and tell you
Well,
the
then
wrong thing.
throw some information my way that you do fix. I know we were talking about appendicitis.
Appendicitis, people with gallstones, acute cholecystitis,
Okay.
incarcerated hernias.
Then let's do focus on hernias, because I'm trying to find something in there that's pretty common that you would also be working with. My son is one of those. He had a belly button hernia very young,
Yeah.
within the first couple of months, and then he just kind of has different symptoms of hernias coming through. How do you diagnose a hernia? So talk about the complaints that the child would have, groin hernias, belly button hernias in general. Talk about the symptoms and what they'd complain about, and then how would you fix that in someone who's young?
Sure. So there are several different kinds of hernias. Like you referenced the umbilical hernia. A lot of kids are born with umbilical hernias. We do not fix those when they're young. Usually probably over 80% of those will go away on their own. We usually let them get to about school age, 4 or 5. If they're persistent at that point, they're probably not going to go away. At that point, it's an outpatient procedure. Their anesthesia risks are essentially those of an adult. It's a day surgery. 2 weeks, they're back to normal activities.
So what physiologically are you doing when you fix a hernia? I know there's mesh in adults. Is that the same with children, or?
No. So umbilical hernias is it's the defect that never closed. All we do is just lift the skin off the umbilicus, dissect out that, close the defect, and tack the skin back down so they've got an innie and they go home. Now the inguinal or the groin hernias are a little different deal. That's a developmental issue. In the male, the testicles start all the way up by the kidneys. They descend down into the scrotum during development. Usually there's a little tiny hole. Usually that hole closes. If the hole does not close, that's what the hernia is. So in kids, all it is just a little incision in the groin. We go in, find that hole, put a little stitch in, and we're done. Yeah, like you said, in adults, there's mesh. Kids grow, mesh shrinks. Bad combination.
Right,
So this does not
exactly.
mean that children later on in life cannot get a different kind of hernia where it's a weakness in the floor of their groin and would require a piece of mesh, but it's just a little stitch, closes it
So
up and we're
how
done.
does one diagnose that? So what are you using, an MRI to go in there look?
No.
Is it an ultrasound? How do you?
In fact, most of the hernias, or all the hernias in my opinion, are diagnosed clinically.
Okay, so you can feel.
Right.
Okay.
We get some sent to us with an ultrasound that says they don't have it and they have it, and I've seen it's not a very reliable source, in my opinion. It's a clinical diagnosis. So typically umbilical hernia, anytime the child screams, he's
it
mad,
pop-
he's constipated,
I
whatever it
remember
is,
that. It freaked me out. Yeah.
his belly button pops out.
Right.
Obviously the reason we fix hernias are that so something doesn't become incarcerated or stuck in the hernia. I can probably count on one finger in the last 15 years how many times I've seen an incarcerated umbilical hernia. So they usually are more concerning to the parents than they are to us. So
It's
a lot of
freaky
our
looking.
a lot of our work is just reassurance
Right.
and let them go on, have a normal life. If it's still there in a couple of years, depending on their age, we'll see them back, and if it's still there, then we'll fix it.
Okay.
We have a higher tendency to fix the groin hernias sooner than later, especially in little babies, premature babies. They have a higher incidence of incarceration, and what gets incarcerated is anytime they increase the pressure inside their tummy, they're mad, they're screaming, they're pooping, whatever it is. That's a path of least resistance, so a little piece of intestine pops through there. So there's always a chance a piece of that intestine could get stuck.
Right.
So things you're looking for are, when they're straining, a big bulge all of a sudden down their groin. When they stop, you can easily push it back in, but something that stays out, the child seems very uncomfortable, maybe is throwing up, their groin is red, tender, you need to go seek emergent medical
So
attention.
clinically, when you're talking, and I'm just going to use the size of my fingers, like if you're feeling a hernia, would it be something that's the size of the index finger tip?
Usually
or
the
just in
defect is
general?
about that big, but it depends on what's pushed its way out of there.
Okay.
If you've got a big enough piece of intestine, sometimes, depending on the size of the child, it can look pretty impressive.
So it could be undiagnosed for a couple of years if the child just thinks, well,
Sure.
I've always had a little pain there. It's just the way I am. And then I remember just years ago, there's a friend of mine that picked up a child and boom, the hernia busted open, but that's, again, in older days. But like you said, if they can fix it earlier than later, then you'd have to worry about it as an adult. Dr. Reyna, I'd like to go back to you because you were talking about education and letting people know about the El Paso Children's Hospital CARES Clinic. And we're about 30 minutes into the show right now. and to hope it goes fast. So I really want to give a lot of attention to this because, as you said, we don't have, or a lot of people may not know too much about it. If this helps any, Gracie Torres in the back is the rock star who is doing the slides, and I'm thinking slide number 6, Gracie, might be a real nice one to put up. It's the CARES Clinic slide, which kind of gives some information about the CARES Clinic, and that way we can kind of talk through it, and then people at home get to see this on the screen as well.
Okay. So yeah, no, this is kind of our mission here. The CARES Clinic at El Paso facilitates a safe environment for children and families to receive appropriate medical and psychosocial services. So when a child abuse occurs, it can be a very stressful time, especially during this pandemic, where there's even more stress added to our daily routine.
Right.
From parents not working, perhaps, to kids not going back to school, to not providing enough meals at home, not having enough resources for food to provide for the kids. It can be very stressful. And sometimes that stress leads to unintentional consequences, like taking out our anxiety, our frustration, sometimes even on our loved ones that we don't really like to see or like to hear about, but sometimes, unfortunately, it does happen.
Your loved ones are the ones that see the best in you, and they also see the worst in you.
Definitely,
so that's
definitely.
where some of these can happen. Yeah.
So we just want to bring out this information to the public, and you may wonder where to turn and how to best to seek help for your child. And we're here to tell you that our CARES Clinic is here to help you collaborate in providing the right care for your child, as well as identifying additional resources available to them. So we want to be more on the preventive side. We want to try to bring out this information and our services to families before we see them in the hospital, and Dr. Spurbeck has to work on them, or one of our surgeons there at the Children's Hospital has
and
to
you
see
use the
this
word
kid's inpatient.
psychosocial. That's so important too. And Gracie, if we can also show slide number 7, and number 7 is some tips to help prevent child abuse. Again, we touched base on some of them, but again, the phone number's up on this slide, etc. And we can kind of walk through this as well. Again, I just feel this is so very important in this day and time.
Oh, definitely. So definitely, if you take a look at that slide there that we have up on the screen, so these are some tips that we recommend families to kind of help prevent child abuse. So definitely try to understand your child. Your child's feelings just as overwhelmed as you are, and unable to express themselves sometimes. Or keep your child healthy, maintain the same schedule as if they were in school or daycare. Like I said, even during these times, same bedtime, same meal time, same schedule as they normally do. Watch your words. Anger or punishing language can be hurtful and damaging to children sometimes. So, and sometimes it's not just physical abuse, it's also actually emotional abuse too. And the way we talk to our kids and the way we come across our kids could definitely play an impact on their psychosocial well-being, as well as their physical well-being there too. So.
Yeah. Does the CARES Clinic also help parents out if they feel like they're getting to that point of frustration? Is that also a number that they can call?
Yeah, definitely. I think we could definitely provide them with more information and how to seek help.
Right, exactly. Because sometimes you're getting frustrated, and before, some people may know it's going to happen. Some people don't, obviously.
And that's where we could come in with some guidance. Usually I tell my families, if you are frustrated and you do have a little one, the best thing to do is just leave them in the room and you yourself take a little break.
Take a break.
Yeah, take a break, go to another room, or just kind of calm down there instead of taking out your frustrations on someone else.
And again, that telephone number is 915-242-8560. And again, you can go to elpasochildrenshospital.org for information. On this slide, and we don't have to show her picture, I'm not sure what the situation is there, but there's a story about Zoe.
Okay.
And I don't know the story.
Sure.
You know the story, right?
It's actually Dr. Spurbeck's story.
Dr. Spurbeck's story, okay. Well, there's Zoe, because on the slide it says, meet Zoe. So I'd like to virtually meet Zoe, or just as we talk about her, but what's the story about Zoe?
Interestingly, this is a good example of what parents should do and how they should not ignore things. So Zoe, happy, healthy, 7-year-old girl, history of kind of some just intermittent abdominal pain. Mom stated, before she saw me that it happened a couple days before, just kind of went away on its own, but then it came back and it persisted. So instead of just ignoring it, Mom took her to the emergency room. They were quick to diagnose that there's something very not right with her, and the emergency room was very facile at examining her, getting her through the radiology suite. Actually, I got a phone call at 10:30, 11 o'clock at night from the pediatric radiologist that she had what's called without getting too technical, a malrotation with the midgut volvulus. It's a developmental problem where the intestines actually during development are actually in the umbilical cord for a period of time growing, and then they, during the first trimester, they actually return to the abdomen, twisting in a certain direction, are fixed where most normal adults. If this doesn't happen, then they have what's called malrotation. The problem with that is since they're not fixed, they have a tendency to twist on themselves, and then when they twist on themselves, they choke the blood supply to the bowel. That's what she had. She had a midgut volvulus. So she was
7 before.
7 years old. Now 90% of these kids usually are diagnosed or present themselves by the first year of life. Then you get the stragglers that get older and older and older. In fact, that's how I can't remember if it was Barry Gibb or one of the Gibb brothers, that's how he died. One of the Bee Gees. So he had a midgut volvulus. She was rushed. Basically, at that point, I activated the system. I called the pediatric anesthesiologist, the team to the operating room. Probably within an hour, we were in the operating room.
Goodness, okay.
The problem is when they're twisted on their blood supply, if it's twisted long enough and it chokes off that blood supply, you can either, one, lose all your intestines and become an intestinal cripple, require a potential transplant down the road, or you can actually die from this. When we got in there, all her intestines were dark blue, which is kind of a scary when you first get in there. We were actually able to untwist them. They showed some.
I mean, I feel like there's miles and miles and miles of intestine inside of you. Before you go on, because that's going to be my next question, how was she presenting? What symptoms was she presenting when she was brought into the emergency room?
Abdominal pain, unrelenting abdominal pain.
Okay.
Abdominal distension. She was bloated. She was throwing up. She was listless. She was sick.
Okay.
So
these 7 years, and this is a hypothetical question more than anything else, but how and why would it have presented that day? I mean, would it just have been built up until? Just
bad luck.
Okay.
Now with that said, does not mean every child out there that has abdominal pain has their intestines twisted.
Right.
So that's, I guess the point of all this is pain, you watch the child, if pain persists, fevers persist, any symptoms persist, that's when you need to go seek care so you can avoid something catastrophic from happening.
Okay, and now I'm going to bring you back to where you were. My apologies for interrupting, but so now you're inside, you're opened her up, she's got a lot of blue intestines in there. You untwisted them.
Yes.
Walk us through that, because that is fascinating to me.
So basically it's basically like
on the,
turn back the
Dr. Reyna's like cracking up over here.
The hands of time, you just untwist it counterclockwise and hopefully restore the blood flow to the bowel. Now, unfortunately, when it's like that, it's been stunned for a while, and it's not like it automatically looks back to normal.
Right.
Her bowel was very inflamed, very not real happy. So it tends to be patchy. There's some parts that look like they're alive. There's some parts that don't look like they're alive. So for her, what we had to do is we actually had to leave her with what's called an open abdomen. We didn't take anything out. Left her with a special, what's called a wound vac, sent her back up to the ICU, intubated on the ventilator, and about 36, 48 hours later, we took her back to the operating room for a second look to see if we were going to have to resect or take anything out.
Right,
Luckily for us, for her, we did not. Unfortunately, at that point, was so sick, so dehydrated, by the time she got resuscitated, all the IV fluids and everything, she's at a point where now we can't close her abdomen. So she got to spend probably a week and a half on the ventilator waiting. Then as her body healed and the intensivist provided her care, we were able to kind of shrink things down a little bit, so we eventually went back and closed her. But she's run around like a normal, happy, healthy 7-year-old. So.
Goodness gracious. And so when you're talking about these different sections of the bowel, I mean, I'm just thinking of just when your arm falls asleep and how long it takes for the blood flow to get back
Usually
in
you got
there.
about 6 hours.
About 6 hours.
Once it cuts it off, you got about 6 hours to save it.
Okay, so she had, say this would have been a little bit more of a worst case scenario. Say that there was part of the bowel that didn't come back to life, so to speak, or get the blood flowing. At that point, would there be a resectioning? Or
Probably
what would you
the
have to
second
do?
look, you take them back, you resect whatever is grossly dead or not alive. And usually that a lot of times requires another look. So you just resect, don't hook anything back up,
Right.
take them back up to ICU, another 36, 24, 48 hours, take them back, take a look again. Basically trying to preserve as much intestinal length as you can.
Okay.
Because otherwise, like I said, they can end up being an intestinal cripple where they require
Right.
nutrition through the vein. They get their meat and potatoes through their vein the rest of their life, which causes a whole other slew of problems, liver
Right.
failure and things like that down the road.
And
So
about how much can you do away with without it being a real problem? A couple of
if
feet?
they retain a third of their intestines,
Okay.
of their small intestine, or a little less, and it depends on the age too. A little baby can withstand losing a larger amount
Hmm.
than an older child that's through puberty, near adulthood.
Mm-hmm.
There's parts of the intestine, if you preserve, the part that goes from the small intestine, large intestine, there's a little valve that kind of slows the contents down, so the part of the small intestine stuff sits there so they can absorb it. If you lose that valve, that's another problem. So if you can
Interesting,
preserve
right.
that, what they call ileocecal valve, you can, little babies, you can maybe get away with maybe having 20 centimeters, 30 centimeters of bowel, small intestine remaining. You're close. You're going to be on the cusp of being able to have enough to absorb nutrients to actually grow.
Right. Goodness. Well, meet Zoe, as you said, 7 years old. She's at home and doing well now, right?
Mm-hmm.
Good job. Good job. All right. I want to go back to, again, let's just talk about pediatrician man stuff.
Okay.
Okay?
Yeah.
We're here, it's the Children's, Paso Children's Hospital. We've had some very specific surgery type questions asked. We talked a little bit about drowning. We talked a little bit about summer months.
Sure.
And just commonly, yes, about the vaccines and the well baby visits. But in general, flu season's about to come, COVID aside. Flu shots, let's talk about those. And the reason I'm saying that too is that people physically have to go somewhere to get a flu shot.
Sure.
So this is a time to advertise what your thought process is on that. And it's not going to be available for another month-ish, month and a half probably.
We're
flu
probably
shots?
thinking about October.
Okay.
Maybe is when we usually get our shipment in for
Okay.
flu shots. Usually
So what
every
is
year.
your idea, being a pediatrician, especially with the age of COVID around us,
Yes.
about getting flu shots?
So I think this year is going to be even more important this year to get your flu shot. Because I'm not looking forward to this winter season
Yeah.
to deal with influenza, with COVID, and then now RSV. So this year, flu season is going to be extremely difficult to kind of rule out which one of these entities is causing the kids' symptoms, because they could all present kind of similar in presentation with fever, runny nose, cough, congestion,
Right.
shortness of breath. So all of them could present similar. So it's going to be a challenge this year to kind of figure out which one is actually causing the
Right.
child's symptoms here. So definitely if we are able to get on top of the flu by giving the flu vaccine, definitely I'm going to encourage even more this year to probably get the flu vaccine
More than years in
more
the
than
past,
more
yeah.
than in typical past years here,
Yeah.
just to kind of help alleviate some of those symptoms there. That if we could prevent the flu in a few kids, it's going to go a long way this
Agreed.
winter season.
Yeah. And I know, originally, there was a thought process that kids were not getting infected and that of COVID. That's not been the case at all. So it's very good now that, not good, it's good to get the information out that kids can be infected.
Sure.
It's not that they're immune from the situation. So again, if you can get the flu shot, do that. And again, here's a question from the audience. Are they recommending that all kids take flu vaccine, and when should that be available? So we kind of touch base on that.
So you could get flu shots as young as 6 months of age
okay.
there. So definitely do recommend if your child is going to be about 6 months of age during October, November,
Okay.
December season, to definitely encourage families to go visit their primary care doctor to obtain those flu shots or elsewhere.
And so let's go on that. We can talk all day long about getting the flu shot. So now let's do the logistics of it. Okay, how do I get a flu shot? Do I have to have a doctor's order? Do I go to Walgreens or CVS? Do I obviously go to the El Paso Children's Hospital?
Sure.
In general, when a parent calls or when you're giving advice to people at a cocktail party that you shouldn't be at because we're social distancing, but in general, where do you tell people to get their flu shots?
Usually I tell them to come to our own my office. You go to your primary care doctor. Usually they do have them.
Okay.
If not, then you could also recommend them to go to Immunize El Paso.
Okay.
Here in town is another great resource to give those vaccines to children.
And are they
Also.
free? That's the big, because we're always going to get that question, and I believe in most doctors' offices, if you have your primary care doctor, that should be included. It's a terrible question to ask doctors.
Sure,
I
sure,
usually
sure.
try not to bring up money or insurance or anything like that,
Yeah,
but
yeah.
it's highly important because that's the question that always gets left hanging, and
Yeah.
I'm asked to address it.
So most insurances do cover the flu vaccine. Now, definitely, if you don't have insurances, definitely we're able to work with families. Definitely, because I think a child's health is worth a lot more than $5 to $10 here. That's going to be needed to cover a flu vaccine. So
Right.
definitely, I think it's going to be well worth it to seek care for the flu vaccine,
Okay.
no matter your financial
Yes.
circumstances there.
And that's always, it's just, again, part of that
It is.
reality that we're facing right now. We are about 15 minutes out, and so Dr. Spurbeck, I would love for you to talk about something that you wanted to make sure we got across this evening that we may not have touched base on yet, or something that we have touched base on and you'd like to expand a little bit more, because sometimes I might be completely missing the boat on what you wanted to get across this evening.
One thing I did forget to mention, that actually in this era of COVID, that it's not unheard of that some kids are showing up with atypical abdominal pain symptoms. I think that's a really important point why everyone that's admitted to the hospital is COVID tested, because we have had to operate on some kids that are COVID positive.
Interesting. Okay.
That sets up a whole, the system that we use in the operating room is from the anesthesiologist to everyone in the operating room, it really is much different than doing a regular operation. But yes, some kids can do present with atypical abdominal pain with the COVID. It's not just shortness of breath or a fever.
Interesting.
We have noticed
Okay.
that. I guess
See,
one
I have not heard that before.
Yeah.
You would think that's really good to know. Okay.
I guess one thing I wanted to stress was that, again, that don't be afraid to see your primary care. Don't be afraid to come. If they refer you to a surgeon, don't be afraid. Obviously, like we talked about the hospital and its testing protocols, the same transfers over to our office, verbal screenings, temperature checks, all that. We're an extension of the hospital. And in fact, hopefully here by the end of the month, we're going to roll out where every elective case that we do is tested preoperatively, is COVID tested. So that, again, that's just another layer of, nothing's 100% in this world, but it's another layer of protection for both the parent, the child, the hospital staff.
Right.
I think that's just a real important point to make. Don't be afraid to seek care.
And we talked about, so we had a program a couple of weeks back, and it was, we're talking about heart attacks and strokes, and people are, again, abundance of a caution is the wording that you would hear, but people just simply were not going in, and there are quite a few deaths, unfortunately, and the family member said, it's like, well, we weren't sure if it weren't for COVID, maybe we would have brought them, but we're not sure, so that's super duper important. Couple of other questions here, but Dr. Reina, I'd like to talk with you, because again, I feel like you're the one that's got all this information to give out to people. So
Sure.
what have we not yet talked about that you'd like to talk about?
I think we covered a lot, but definitely I just want to remind people that the CARES Clinic is here for the city of El Paso. We are an assessment center for suspected child abuse and neglect. And one thing is we evaluate children in our outpatient clinic on an appointment basis only. So definitely if there is a question, we'll get you in and we'll schedule an appointment for you. But we do everything from non-acute sexual assault exams, which means that someone's been assaulted greater than 120 hours.
Okay.
If it's under 120 hours, we do recommend them going to probably one of the hospitals to get evaluated.
120 hours from when they
from
were
the
sexually
from the
assaulted.
incident, yes, from the
Okay.
assaults.
Okay.
Or we do forensic photographs, any suspected child abuse or neglected medical assessments, any follow-up on any non-accidental trauma, or any child abuse prevention training, or even drug exposure. Sometimes that's kind of considered in terms of abuse. If a kid comes positive for any kind of illicit drugs, we do have to investigate and kind
Right.
of do an evaluation on the situation and the home. And that's something also that we provide services and guidance for family members there.
Now, is the CARES, when we talk about children, I always, in my head, I'm thinking, when is the age of a child stop? Is it 18? Is it 21? Say someone's being abused and they're 23.
Sure.
Is CARES still, would they still be eligible is the wrong word, but would that still be something that we could look at? Or is it, there's a certain cutoff age?
So the cutoff age, I think, is under 18, 17
Okay.
and under
Okay.
will be the CARES clinic. Now, definitely if you are above that age, there's other services and other providers that will take care
Okay.
of you, but never
And
be
might you
never be
know any
afraid.
off the
Never
top
be
of your head?
afraid. What's
Yeah, might you know any off the top
I
of your
do
head?
not know off the
Okay.
top of my head.
Okay, then what I'll
about those.
do, just in case, because I'd imagine whoever's answering this telephone would probably have some of these other places to call. But again, the telephone number for the CARES Clinic, any type of child abuse suspected or, like you're saying, drug issues or
Neglect, yeah.
frustrations, neglect, telephone number 915-242-8560. And if you are an adult and you're being abused, again, you can call that number too, and they might be able to give you some other information. But again, 915-242-8560. And also you can always dial or log into the elpasochildrens.org. Just spell out elpasochildrens.org. And that's a website that has, again, up-to-date information. It's got a lot of up-to-date information on COVID as well. You can ask questions on that website. So if you are a parent of someone who, this hernia, I think keeps coming back. Do I go in? Do I wait till COVID's over? I need to bring my son in, by the way, because it's just one of those things like, well, it's not that bad, but I can feel a little bit. That's why I was asking about the size and what parents are looking for on that. I want to give out this website again, then we've got a couple of time for some more questions. The website to watch this show back again is www.pbselpaso.org, and then also through the El Paso County Medical Society, which is www.epcms, and that one is .com. I have quite a few questions here, but they are more trauma questions than anything else. And I know that Dr. Spurbeck, you said you don't really deal with a lot of childhood trauma, but I thought it would be nice to talk about some of the stuff that happens in the summer. So now you're both just pediatricians. Put on that hat, and I get stung by a scorpion or a black widow. And what do I do now? So let's talk about some of these summer things that are going on. And you're giving the eye to Dr. Reyna. Dr. Ray, you get that.
I call my wife. She's a pediatrician.
I am in the
Yeah,
scorpion
yeah.
club. I live in a place that has quite a few scorpions, so I know the pain.
Sure.
But I'm a grown woman, so let's just say little ones, they don't understand that. Number one, the pain, but then it's like the Novocaine feeling where things
Yeah,
go numb. I know what it is, but a child getting stung, how many of the incidences have you had with that? And let's just say scorpions, black widows, brown recluses, in general.
Yeah, luckily not too many. So
Right, knock on
personally,
wood.
yes, knock on wood. I hadn't personally had to deal with a whole lot. But like you said, do not delay medical care. If you suspect that your child is portraying some of these symptoms and did get bitten by or stung by something like this,
Right.
this is where you need to call your primary care doctor or definitely go get him evaluated. If he's acting more pain out of the normal bite, if it's
Yeah.
causing him more distress and it should typically look like it should be, then definitely
Right.
take him in.
Like what neurologically, like if a black widow bites you, there's some neurological issues that come along with that too. Anti-venom, we can talk about
Yeah.
what some of the extreme treatments would be.
So yeah, like you said, just severe pain, numbness in that general area, definitely just more pus or more redness leading up to the arm. There are some signs. Fever is definitely a big sign of more serious infection or bites.
And clinically too, as you were saying, Dr. Spurbeck's word, the brown recluse, for example, I've seen people that have had those bites, and it's just that the tissue starts literally dying and rotting away. So that happens just a little bit, go to the hospital immediately. Question here from the audience, thank you. How would I know if again, this is something beautiful that you said earlier, how do you know the difference between the COVID and a flu in my child? A direct question here from the audience. I don't have an answer. Every answer I've heard, go ahead.
So right now, it's not flu season, so we're treating more like it's possible COVID, because that's what's kind of predominantly right now occurring. Now, like I said, in the winter months when flu season is starting to peak, starting December, January, February is kind of when flu season typically is more prevalent. Then that's going to be the more challenging for us as pediatricians to kind of figure out which one of this. If COVID continues to progress and continues through the winter months, that's going to be a little bit more challenging for us to kind of see which one it is. But right now, we're not seeing too many flus, just more COVID cases, so that's what we're treating. Kids that are coming in with fevers, coughing, and congestion, we're kind of testing more for COVID instead of flu at this point.
And the old saying of wash your hands, don't touch your face.
It's still very important.
Yeah, that was it before COVID. It really got emphasized during COVID. But again, everything the precautions that are in place right now, wearing the mask, washing your hands, don't touch your face, all that still goes. So think about that when it comes to the flu as well, and the common cold.
Yeah.
And again, the testing, I don't know, how does one get tested for the common flu? Is it the same?
It's a nasal swab.
Okay, also
yeah,
a nasal swab.
Nasal swab.
I wanted to say once again thank you to our medical students who have been lovely and wonderful about getting all the questions my way. We have with us today Melissa Huddleston, and then we also have, oh my gosh, Thomas, what's your first name? Prakash Thomas, sorry. He actually substituted in for someone, so thank you for showing up, because that's never fun to get that last minute phone call and say, okay, yeah, I guess I'll go over there. So I appreciate you guys wearing your masks and answering the phones and being nice to everyone. I want to say a huge thank you again to the El Paso Children's Hospital, and again, CARES, C-A-R-E-S, it's an acronym, and you can call the El Paso Children's Hospital. That telephone number for CARES specifically is 915-242-8560. And again, the website is www.elpasochildrens.org. This has been a show about don't delay your child's health care. So if there is something going on with your child, yes, it is the day of COVID, it is the time of COVID, but there are safety precautions in place at all the medical clinics, at the El Paso Children's Hospital, at all the doctor's offices. And so that's something that we're trying to stress on this program, and the medical program, that it is still important for you to get care for your children. That really matters. There's precautions in place, and you beautifully pointed that out as well. Again, if you want to watch the show again, we're streaming live on YouTube currently. You'll be able to watch the show on YouTube again, and then also www.pbselpaso.org. You will go to watch and you'll find local programs, and then you'll be able to see the El Paso Physician on there and other programs that PBS El Paso puts together, a lot of great information. And also a huge thank you again to the El Paso County Medical Society that's been bringing the show to you. They also have all these programs, a backlog and an archive of the programs on their website. And their website is www.epcms.com. I'm Catherine Berg, and we very much thank you for joining us on all these informations and these programs. You've been watching the El Paso Physician. Good night.